My name is Rachel Hartford, and I am the Executive Administrator of Heartland Community Health Center here in Lawrence.
Rachel, tell us a little bit about your career path, what you studied in college, and how you got to this position you're in today.
Sure. So I actually grew up in Eastern North Carolina, where I thought I was going to pursue a career in medicine or the medical field. And so I thought in order to make a meaningful contribution, I needed to become a nurse, right? And so I journeyed down a very traditional path: high school, college, started into nursing school, and was about, I don't know, a year and a half in and realized, I don't know if I really want to be in direct patient facing care. And I had the privilege to travel abroad several times in college and participate in medical missions, because beneath this desire to serve in healthcare is a desire to just be a part of humanitarian work, nonprofit work. And so I was able to travel and went abroad and served in Liberia. And on my way back home, had the opportunity to reflect and think about what, we had just been a part of, serving thousands of people in vulnerable situations. And I realized we did really great work because we took a lot of care and supplies to remote areas, but we really didn't do anything, have a sustained effort or provide education or in a way go upstream and help someone. And so I came back, and that was really a pivotal point for me to change my career path. And I ended up going to Bible college. I switched gears and studied nonprofit management. And so I, interestingly enough, still ended up in healthcare. And I know we're going to talk a little bit about that, but so I started in nursing school, did not want to be a part of direct patient care. I was more passionate about being behind the scenes and helping frontline staff members or providers be as successful as they can be for the long haul in the community. It's really great to provide care when it's immediate and when it's urgent, but it's so important to find ways to be there for the duration in a community, not just dig in your heels and get to work, but really roll up your sleeves and partner with people in your community so that you can actually see health for the long haul.
Will you tell us a little bit about Heartland Community Health and then also your position there?
Sure. So Heartland Community Health Center, we are a federally qualified health center. And so what does that mean? That means we're an organization that exists for all people, regardless of ability to pay or insurance status. We know that, especially in our country, there's a lot of discussion around healthcare and access to care. And quite frankly, I believe that in our country, we see a lot of injustice when it comes to healthcare. A lot of people are forced to stay on the sidelines because they can't afford or overcome barriers to see a doctor or to get their labs done, or to have any type of preventative healthcare. And so community health centers, there are about 2,100 across the country, and Heartland is one of 18 in the state of Kansas. And we are specifically designed to help anybody and everyone overcome those barriers to care so that they can have access. And so at Heartland, you'll find primary care, just like what you would at a family doc's office, behavioral health, psychiatry, dental providers. We offer wraparound services because we acknowledge that someone's health is made up more than just biology. It's psychosocial. It's those social determinants of health: where you live, how do you eat, who do you spend your time with, do you have sidewalks in your community? All those things compose and make up someone's health. And so community health centers are designed to take care of the whole person, regardless of any barriers that you may face. So we've been around in Lawrence since the mid-2000s, but have been a federally qualified health center since 2012. And it's been a wild ride, but it's a really great organization. And my role, so as an executive administrator, I have the privilege of working on strategy and very specific projects. So a lot of project management, a lot of grants, a lot of grant management. I work closely with our administrative team that essentially helps move our operation forward. And I get the privilege to connect the outside world, so beyond the four walls of our operation, internal to Heartland, and then communicate what happens internal to Heartland to the community.
So, what skills and knowledge would a person in your position need?
People skills. We do a lot of talking. So administrators, yes, critical thinking, um, good writing skills, good communication skills, all that absolutely matters. But there's also a level of being willing and able to adapt, being nimble, being flexible. Healthcare, while it is best practice and very proven, it's rapidly changing. Healthcare is, yes, innovative, and although innovation in healthcare can take time to communicate or to showcase, you have to be able to adapt, especially to the needs of your community. Creative thinking, like I said, being innovative, having a willingness to think outside of the box. Just because a system is designed for a certain type of way doesn't mean that's going to be the solution to your problem in your community. So I think the biggest thing is just having the ability to adapt, the ability to be flexible, and the ability to have empathy. I think it's really easy to, especially as administrators, to get kind of comfortable behind your desk or in your office suite. And we can sometimes forget that there are people in our community that are depending upon us. And so we oftentimes talk about in our organization, empathy and compassion really helps to move you forward in, quite frankly, any line of healthcare, really any job. Don't lose your empathy or your compassion.
So, we talk about the different job opportunities or the different positions at Heartland that help it to run.
Sure. Yeah, it's an interesting machine when you look at it. People often think in healthcare you have to be a provider, or a nurse or a lab tech, or even front office or patient service representatives. And yes, those are incredibly important roles, but there's also that back end of support. And so when you think of healthcare, it goes beyond just that direct patient facing service. And so for our team, we have a financial officer, a chief financial officer. And yes, numbers tell a story and they tell part of the story. But for folks that are in healthcare and finance, you really have to have an understanding of the healthcare system, billing, coding, reimbursements, productivity, the needs of your community, understanding your needs assessment, even for a finance officer. HR, same thing, being able to recruit and connect with healthcare professionals that are passionate about providing care, super important. Our chief operations officer is actually an RN, but she has now found herself in a full-time administrative role, and she helps to essentially make the operation run, scheduling, organization, agreements, making sure that your agreements and BAAs are all up to date, and those details are mission critical. Partnerships. So for our executive director, our CEO, managing strategy at that super high level, being able to look on the horizon and see what's ahead in an environment that is consistently changing, finding creative ways to partner with other organizations, especially in a community the size of Lawrence, where we have one hospital, one community health center, one mental health center. It's very important that those providers partner and work together. We have a quality and risk coordinator. And so, yes, there's a lot of risk and a lot of quality management in healthcare, but not risk like malpractice per se, but risk like What do you do if your health center is in operation and there's a natural disaster that's happening? How do you move people in the community? We also have what we call super users on our staff. And so these are people that are experts in electronic medical records, because quite frankly, you have to know the tools that you're using for your operation. And so if your IT goes down or if your EMR doesn't work, providers aren't experts in EMRs. They are experts in finding diagnoses to help make people feel better, right? And so that's a little bit of our team. But yeah, we work with communications and marketing team members. We work with individuals that are directors of foundations and philanthropies to help support healthcare. I think sometimes we find ourselves believing that healthcare services like community health centers or safety net clinics are free. There's this idea that healthcare can be free. Somebody's paying for it somewhere. And so having those partnerships with other agencies are very important as well.
So tell us about the biggest benefits and the biggest challenges of a profession in public health.
I would just say again, healthcare is rapidly changing. Healthcare can become very political very fast. People like to argue about resources and the injustice that exists. And sometimes I think the best thing that we can do is, like I said, roll up your sleeves and get to work, and having the ability to adapt and be nimble. But I would say not every solution is an answer for every community. And if you look at the health in our region in Kansas, it's going to look very different than the health of Eastern North Carolina, where I'm from. And so allowing systems of care to be able to adapt and respond to the needs that exist in that community, I think can be a benefit and a challenge. Navigating, finding resources to help respond to the specific needs in your community is a challenge that we often embrace. I oftentimes tell people that the best thing that I get excited about my job is the ability to find creative solutions, to find ways to say yes, because people are oftentimes told no. You oftentimes get to a place where there seems to be a dead end, and people think, well, this isn't an option for me because I can't afford it, because I don't have transportation, because I don't have adequate social support. I don't have the tools to help me move forward to better health or improved health outcomes. And that's not true. It's just finding ways to connect to people. I also think in healthcare, we wait until it's urgent, until it's a disaster, until it's a crisis to respond. We are designed to respond to emergencies. If you get hit by a car, if you're diagnosed with cancer, if you break your leg or a bone, we're really quick at responding to urgent. It's the investment in prevention and primary care that helps us to get upstream to prevent some of these urgencies. And so I would say finding ways to say yes to people who want to get ahead and be more preventative. And that can be a challenge. It's not as fun. It's not as urgent. It's not as what you see on TV, right? That's not how healthcare needs to be designed all the time.
So what advice would you have for a student who was exploring, the variety of healthcare careers?
I would say keep an open mind. One of the things that, like I said, in my traditional path, I assumed that if I was going to be in healthcare, I was going to have to be a provider or a nurse. But keep an open mind and stay true to your passions. If you have a passion for systems, data, connecting with people, messaging, telling a story, creating, inspiring content, there's a place in healthcare for all of those talents and desires and passions. So keep an open mind and ask questions. Just because someone says this is the way it needs to be may not be true. Obviously, you can show honor and respect the professionals and people that are placed in positions of authority, but having curiosity to understand why is not a bad thing. I think that helps you to think creatively and to look at things in a different light. And like I said, not every solution that's provided is the given answer for the need in your community. And I think through having curiosity and the willingness to ask questions, help you to find creative ways that might end you in healthcare in a very unusual spot. So yeah, and think outside your lane. So oftentimes we meet students that are either shadowing in our health center or in their residency, and they have their mind made up. I'm going into this, family medicine, orthopedic care, whatever it may be. And then sometimes they get in and they see that their healthcare is bigger than their lane. And then they change paths. So just keep an open mind, be curious, ask good questions. Yeah, and stay aware that healthcare is more than just direct patient care. There's a whole system that impacts what happens in an exam room at time of service.